welcome back. Unemployment numbers being released.
Wow.
3 million
3
plus.
million.
We'll continue to have more on that coming up at 7 o'clock on CBS this morning. Meantime, back here in the Treasure State, the news continues.
Yeah.
Things are changing on a daily basis here. Here are the latest numbers of coronavirus cases in the state of Montana. Total number of confirmed cases now stands at 68. Gallatin County has 24. 5 new ones, including a female in her 70s, a female in her 40s, a female in her 30s, a male in his 20s, and another male in his 60s. Silver Bow County now at 4, Madison County at 2. Cascade County added to the tally with 2 more last night, a man in his 30s and a man in his 50s, for a total of 4 cases. Lincoln County, by the way, has confirmed its first case. You can see those other counties that have cases reported as well. We are told so far 2,193 people have been tested for the virus.
City County Health Officer for Silver Bow County, Karen Sullivan, sends news of more closures last night. In addition to closures that were already in place, an order adds hair and cosmetic salons, as well as barber shops and massage services, except in physical therapy or a chiropractor. Church services, funerals, and memorial services may only have 10 or fewer people, and all must be spaced 6 feet apart. Those closures are expected through Friday, April 10th.
Also, Bozeman Health banning all visitors at all of its facilities effective immediately. It is an effort to limit the spread of coronavirus on medical properties. Bozeman Health officials say the strict visitor limits will help to protect hospital staff and patients. In addition to keeping visitors out, staff and patients entering Bozeman Health facilities are screened. Temperatures are checked and they're asked quick questions about any COVID-19 symptoms they may have experienced. While most visitors are being kept away, there are exceptions.
If there's a pediatric patient or an individual currently in labor, they are allowed 1 visitor or companion over the age of 18. And then of course we obviously want to be very sensitive to those that may be dealing with very difficult circumstances, such as end of life, cancer diagnosis, or perhaps those that may have autism, dementia, or Alzheimer's and need that companion with them.
Patients with mobility issues are also allowed to have a companion. Brendel says the restrictions will stay in place until the Gallatin City County Health Department and the Centers for Disease Control recommend otherwise. Also, the same policy is in place at St. James Healthcare in Butte and Community Hospital of Anaconda. Patients at Barrett Memorial Hospital Healthcare in Dillon are allowed 1 visitor per patient with no symptoms, of course, of sickness. And Montana Attorney General Tim Fox and his colleagues are warning large online retailers to make sure no resellers are price gouging by overpricing critical items during the COVID-19 shutdowns. Fox is calling for Amazon, Walmart, and others to put a stop to practices where items such as bottles of hand sanitizer have been going for literally hundreds of dollars. At the same time, as MTN's Dennis Bragg reports, the AGs are also concerned about practices that could take advantage of rural producers.
Many of us have experienced that rush for food, which emptied many store shelves over the past couple of weeks. But it turns out there's some evidence of a problem on the ranches and farms, too. Fox, who is president of the National Association of Attorneys General, is also worried about beef and other products.
We're very concerned about the possibility and potential, and we may have even seen some of this, where the meat packers, who there's just a number of them, they're large companies, may have been reducing the price paid to cattle producers in places like Montana, while slightly raising prices that they're selling to the retailers and the supermarkets.
Monday, U.S. Attorney General William Barr warned the Justice Department is cracking down on companies that may be hoarding and overcharging for critical medical supplies. And during a call Tuesday, Fox says he urged Barr to keep rural producers in mind as well.
And we'll continue to work with his office to make sure that people don't take advantage of this crisis by taking advantage of Montanans or any American.
Fox says the attorneys general want to make sure that the current crisis doesn't erode the progress that's already been made on consumer protection, whether it's in the field or online.
We've had a lot of success over the years, particularly in the area of consumer protection, in working together across state lines and also with the federal government.
In the Bitterroot Valley, Dennis Bragg, MTN News.
Just ahead of 6:41 now, new data from the Centers for Disease Control shows that coronavirus is now starting to affect younger generations more.
The agency's report shows nearly 40% of those hospitalized are between ages 20 and 54. That means more young people are getting seriously sick than initially thought.
It's easy to draw a conclusion. Oh my gosh, maybe younger people are more susceptible to the disease. Maybe they get sicker with the disease. And that's premature.
Dr. Steve Cobb says we don't know why there have been more cases in that age group, but he does think more cases are becoming critical as total cases surge. He also points to reports that some young people aren't practicing social distancing.
Now in France and Italy, young people have been in ICUs with complications from COVID-19. Dr. Cobb says they're still learning from Europe and China. More testing is needed to fully understand that virus.
Until we have widespread testing available, we're just not going to know. And so we're always going to be guessing, who's more at risk, what population is endangered. But what we know for sure is this young, healthy population who I think can be at risk for thinking they're not vulnerable is absolutely at risk for contracting this virus, getting severe invasive disease and dying.
Now, the CDC says the greatest risk remains with the older population. About 80% of Americans who have died from COVID-19 were 65 and older. Less than 1% of coronavirus deaths were people ages 20 to 54. So
I think really important to remember that, especially like among my age group and everything. Just because you're not in that critical age group doesn't mean you can't get the virus.
And it doesn't mean you shouldn't practice social
Stay away.
distancing. That's
Exactly.
really hard
Exactly.
for some of that. That's a really good point, Caitlin.
It's not easy for anybody, but it's something we have to do.
Just stop and think a little. Yeah.
All right, we're taking a quick break now at 6:42, but up next on Montana This Morning, the largest economic relief package in history, how the COVID-19 stimulus package is supposed to keep the economy afloat for 3 months. That's ahead, and here's what's coming up on CBS This Morning.
Good morning. Ahead on CBS This Morning, how New York City hospitals are coping with the rising number of coronavirus cases in the state most affected by this pandemic. Plus, why people who take medication for chronic diseases are struggling to find the medicine they need amid all this. Also, disappointed college students tell us they feel cheated out of their senior year. I would too. And we have some tips to ease any tensions in your relationships during this difficult time. Tension? What tension? We'll see at 7.